On this episode of Africa Health Check,
people are not informed, people are not empowered to know about health issues, what you can do in order to improve your health.
And most people in Uganda here, they don't take hygiene as something important. Therefore, health-wise, people are not doing very well.
we discuss the importance of WASH practices in improving healthcare outcomes in Africa.
My journey has been to build Weyonje, which is sort of like an Uber for sanitation right now, and it's being used in the communities to request for sanitation services.
And identify some of the common challenges in their implementation. Among the major impediments to many African communities realizing their universal health coverage outcomes is the lack of access to clean water, sanitation, and good hygiene. On today's episode, we will be discussing water, sanitation, and hygiene, or for short, WASH practices for health. I am your host, Khukhuntajam Paladi Morokoto, and I welcome you to Africa Health Check. I'm joined by our experts, Dr. Marianne Mureithi, the chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. But before we hear from them, let us have a look at this episode's feature story.
My role at Kampala Capital City Authority as an innovation specialist is to be able to look at what challenges we have for public health in Kampala, and then I'm able to give solutions, technological solutions to improve them. Through those solutions, the first one was I was able to set up a contact center, which is being used now for the city. People are able to call and able to get to ask questions about what's and also report and get services through the call center. Then I was able to set up an ambulance call center for the public health, and that ambulance call center has been able to help for disease outbreak, especially in the times of COVID and Ebola. Then I've been able to build mobile applications for the area of sanitation, which is really my passion right now. And when my journey has been to build Weyonje, which is sort of like an Uber for sanitation right now, and it's being used in the communities to request for sanitation services. Ever since we set up the innovations that we have right now, there's been a very big decline in disease outbreak. So with the data that we're able to receive through the technologies that we have, we're able to plan and anticipate any disease outbreak and be able to curb it before time. About 8 years ago, the authority was struggling to be able to reach people with services of pit emptying or management of solid waste in their households. So I came up with an idea of, if we are able to order a car and it comes to us and takes us wherever we are going, why not, can we not be able to use the mobile phone to order for a sanitation solution? So we started with the call center where people would call us, and then we are able to refer them to get someone to go and empty their toilets. But that was not enough. We're not collecting enough data. So we built Weyonje, which is a mobile application through which a client in the community or a customer in the community is able to request for a sanitation service. Weyonje has been built and has been operational for the last 3 years. There is an application for the service provider who works directly with the customer, and an application for the customer. But we also have the informal settlement. We all know that Kampala consists of 60% of the informal settlement, and we need to serve them as much as we are serving the urban center. So we also came up with a VHT application through which we are able to know which people that we can reach with subsidies of sanitation. So Weyonje is sort of like an Uber for sanitation. I joined Text to Change in 2011, and majorly it was about using SMS to transform lives. Can I send an SMS to remind a pregnant mother to go to a health facility? Can I share motivational messages to a pregnant mother as they go through their journey? What are they supposed to eat? When are they supposed to go to the hospital? Reminding them about ANC. So it was really a journey of looking at what are challenges that people are facing in the area of health, in the area of agriculture, and share them with just a very simple tool as a mobile phone in your hand. So that was really Text to Change, mobile for development, setting up programs in the area for mobile for development to change lives. My experience with Text to Change was very inspirational. We set up a program in Tanzania called Wazazi Nipendeni, and we were able to reach over 200,000 mothers with information on when they can go to the hospital. With the SMSs that we shared, there was a 50% decline in maternal deaths because they were able to cap all these incidences before they happened. I was selected in 2022 to join the International Water Association Digital Committee. Through this committee, we are able to advocate for better use of technology in the area of water. We are able to share innovations that are being used worldwide that can be able to work for countries. But most of all, it's a platform for knowledge sharing. We bring together a lot of knowledge that we put together and share with various countries so that they can be able to improve the way they use technology to improve lives for the people in the communities. I'm very passionate about Sanitracker at the moment. It's very exciting. It's been built on the inspiration of what we've been able to achieve with Weyonje. Sanitracker is still an Uber for sanitation, but it's open for African countries. We chose to give it an English name where everyone can be able to relate to. Though, for countries that feel that they can take on a more local name, they can also add it to what we have already created. Sanitracker will be able to deliver a holistic sanitation services to people in Africa, and countries can be able to adopt it. Coming from solid waste, from fecal sludge management, from unblocking pipes, from plumbing, the whole sanitation chain activities are all going to be part of Sanitracker.
Really incredible stuff. I don't know about you, Reverend Dr. Marian, but each time I watch the feature story, I'm like, goodness, what am I doing? People are doing incredible things. You know, when you hear of some of these feature stories, what people are doing, you're thinking, this is so simple. Why couldn't I come up with this? Why didn't somebody do this earlier? Isn't it just incredible?
Indeed, and I feel very challenged. You know, very simple, innovative tools, but wow, the impact. You've seen the data you're showing in Tanzania, maternal health, the maternal outcomes, and other outcomes she was showing in the feature is amazing to see the impact on the society and the people who need it most. So really, I feel encouraged to really look around me. How can I make a difference with the tools or knowledge that I have?
That you have, in the space that you have. I think it's just really amazing. And I hope that the viewers at home are also taking this as lessons. You know, it's a benchmarking opportunity. You see what's happening in Uganda. You see how you can bring it to Botswana, to South Africa, to Nigeria, to Ethiopia, and see how you can also implement the same initiatives.
That's a Pan-African spirit.
That is the Pan-African spirit. That is ultimately what we mean when we say Pan-Africanism, Ubuntu, you know. We're talking about WASH, Reverend. Currently, what are the biggest infrastructural gaps hindering implementation or even enforcement of WASH practices?
Infrastructural gaps. I believe that our people need to come to understanding about the value of good water, the value of good sanitation to a community, and then community or personal hygiene to life as a whole. You were talking about this Uganda presentation, would have thought about some rocket science or something, but it's something as basic as the water that we drink, you know, our environment. How do we take care of it for the environment to take care of us? Not any big thing. So what I think that we are not there, you know, thinking about what to do, where is the money coming from, but looking at very simple things, and then inventing or thinking of something that will solve the day-to-day problems. I think yes.
Absolutely. Maybe you want to add on to some of the infrastructural gaps that you've identified throughout your work, where we're still lagging behind generally as a continent.
So when you're talking about infrastructure, I'd like to look at it both on the material aspects and the human aspects. In terms of the human aspect, first, we have to create awareness about water, sanitation, hygiene. And I have this lecture I give my second and third year medicine students, and I start the lecture by asking them, when you walk around the streets of Kenya, and I think it's everywhere in Africa, you find food vendors preparing food on the road. Here you'll find people roasting maize, or doing several things. And I always start my class and ask them, where do you think our vendors are washing their hands? They're handling money, they're burning food, they're giving you food, they're packing food, they're doing so many things with their hands. Where are they washing those hands? And it's always thought-provoking, and there's always, they have a bucket, but I'm like, maybe they're even washing their utensils, everything in that
same bucket.
And what I'm trying to create an awareness here with my students is this vendor aware of wash? Do they know that they need to wash their hands with clean water as they're handling food? And this is food that's going to be consumed by the patient they're going to see in a few minutes. So can we start at the source? So again, creating awareness is a human aspect. In terms of material aspects, we have a long way to go. I think in a few episodes ago, I talked about London. They identified a problem with wash, and they had what we call the Black Death or plague. But they identified the problem was to do with their sewages. And immediately they started an infrastructural campaign, changes, and that way now you're able to see that curve go down. I know the World Bank has started funding a lot of projects in Kenya in particular on sewerage. In terms of taking the sewerage out of the ground to under the ground in pipes and directed to a particular point where it will be undergo some treatment. And again, that's a huge infrastructural change. But again, it involves both non-government organizations, governments, people,
multiple
so
stakeholders.
It's again really transdisciplinary aspect to be able to implement the WASH campaign. And it's fantastic to see even on the ground we have people participating in making sure that we have a thriving community, a thriving society where we'll have the vendors, because I like the vendors because they're really trying to win their daily bread. So we really need to ensure that again we're creating an environment that indeed these SMEs or these SMEs, small middle income communities are thriving.
Absolutely. You were talking about awareness, and maybe let us use this as an opportunity for you to give a very comprehensive overview on how WASH practices significantly reduce the burden on our healthcare system.
Yeah, so I can start with a very practical example. During COVID-19, can you believe that we actually saw diarrhea and gastroinfection or infections going down?
Yes.
Can you believe that? For the first time in, I think, forever. The curve of diarrhea infections, even in the main hospital in Nairobi, the Kenyatta National Hospital, it went down. Why? Because people took the simple measures of washing their hands. People are very careful what they're consuming. And again, I really would want that practice to continue. So that's something measurable. We have a lot of articles written in terms of if we can adopt such practices over and over again, we are going to see some of those WASH practices come up. That is just in a personal route. What about again as a community? Are we building enough toilets? We have what we call here flying toilets. And let me explain to the viewer what a flying toilet is, because in the slum areas or in very populated areas, they'll not find a toilet structure, a private toilet structure, where again, all the human waste can be directed in a bowl or in a hole. So what they do, they take a paper, help themselves, wrap it, and whoop, throw it. That's a flying toilet. And again, it's something we've seen here in Nairobi, in the slums. And now we have initiatives where, again, campaigns to build toilets in these peri-urban places so that we avoid that phenomenon we're calling flying toilets. Again, can you imagine throwing all that? So cholera, typhoid, name it, dysentery will start circulating in the community. So that, again, that really deals with sanitation, hygiene, and again, it involves the entire community coming together. From the community gatekeepers telling people, hey, stop that habit, okay? There's this structure now the government has put up in place, or this NGO, and direct the people and teach them how to use them and use them properly. So we have a lot to do. There's a lot that we need to build up in terms of infrastructure, in terms of awareness, in terms of even deliverables that both the government, the county government, the NGOs, hospitals, the medical doctors, the chiefs, and other community gatekeepers need to do so that we can achieve a healthy, thriving community.
Absolutely. I think, yes, please go ahead.
It's all about knowledge. It's all about
public education.
Exactly. So why is the maid seller not washing their hands? And why? Because they have no clue that the dirty hands will affect the food. And if you eat the food, this is what will happen. If they do understand that, then they will be willing to support any infrastructural development or any program that is about. Most of our people don't understand. They don't even know. So even if you build a toilet, they won't use it. They they say in Ghana and other countries, open defecation. If there's nobody coming, then they sit somewhere and get people have even been to school. So it's all about sanitation, clean water. This personal hygiene thing is educational. There is a deficit. There is a gap somewhere.
And maybe mindset change, because sometimes you're privy to the education and information, but it doesn't resonate with you. It doesn't yet make sense. It hasn't sunk in. You know how we say you take things seriously when they hit closer to home. That's when you actually realize this is actually a major issue. Because if we actually take the example of COVID-19, there was a lot of public education, and the fact that we also saw a reduction in cholera and even in flu, because a lot of people are like, wow, I didn't get flu this year, because you're washing your hand, you are cautious of how you sneeze, how you cough. But you see, very quickly after we all got vaccinated, we all went back to those bad habits. So you see, is it really a matter of education? Because we are aware and we have testimonies from those 2 years of lockdown, but how come we can't be consistent? We're going back to those habits.
Yes. I would have liked for churches, would have these buckets there. They wash their hands before they go to worship and then leave. You go to banks, it's the same thing. You go to many places.
Anywhere, really.
So why not continue even after the pandemic?
Again, I feel it's because we stopped talking about it.
Exactly.
So again, I think as human beings, what I'm learning now, we need to just keep talking about it. Don't stop. Just keep talking about it. Have reminders. Have media also come in and just have constant reminders. Because I think that's what was a winning formula during COVID. Just that creating awareness, and it was consistent. So we need to not break that momentum. And I believe, again, we are going to see a reduction of some of these really challenging aspects of WASH.
Yes, no, I think that's true. I think we've just all sort of dropped the ball now. We're thinking we're back to normal. There is no need for that public education. After the break, I want us to just get into talking about some of the initiatives that you had some of the initiatives that you've been part of that were successful at different levels, whether in schools, in your work, at your church, and just as a way of sharing with the community at large that these are some of the initiatives that even in our personal capacities, we can uptake in our communities. But for now, we are going for a quick break where we hear what the people on the streets in Africa had to say. Stay tuned.
I believe the government should educate the public more about the benefits of being vaccinated. Because at this moment, I shouldn't say the youth, the population, don't believe the vaccines actually work. Or they actually believe the vaccines are going to bring more complications to them. So education is what I think should be done more.
Hospitali, dispensary, tunatakiwa tuongezee wahudumu wa afya ya kutosha, vifaa vya matibabu vya kutosha, madawa ya kutosha, na mazingira hospitalini yatengenezwe kwa ubora zaidi.
As a young leader, I would recommend that there is a lot of things that need to be improved when it comes to legal and policy reforms. We need comprehensive laws and policies that actually standardize and ensure that the vaccines or the medications or the things that do work in South Africa, they have to work in Tanzania, they have to work in Comoros, they have to work in Zimbabwe, they need to work everywhere.
Welcome back from the break. You are still watching Africa Health Check, and today we are discussing WASH practices. I'm going to go back to you, Dr. Mary Ann. Please share with us some of the programs, initiatives, innovations that you've been part of that were promoting WASH practices, and maybe even share how effective those initiatives were.
Yes, so I'm one of the directors of a laboratory where I'm based at the hospital and at the university. And we are starting out an initiative in conjunction with the county government of Nairobi, where the county government is the one charged to test all food handlers in the city. They need a certificate from the county government before either you open a restaurant, and if you open a restaurant, all waiters should have the certificate that they know how to handle food. And on top of that, they are vaccinated against typhoid and other vaccine preventable diarrhea infections. What you've noticed is a lot of shortcuts. Yeah. Some restaurant owner will not want to have his staff go through that, so they pay a little money and they still get the certificate.
Correct.
So what we are wanting to do, again based on corruption, we want to first create awareness, so an educational drive together with the county government, the importance of having these food handlers well certified, because we've seen restaurants shut down when there's a cholera outbreak and people pinpoint, it was from that restaurant. Yes. That restaurant ends up losing customers, getting shut down, and they have to restart again. So we are working together with restaurant owners, other food handlers, that they're aware of the importance of having these vaccines, the importance of just simple hand hygienes. And I'm hoping that the next year when we meet, I can tell you, we made, this is the cough now, this is where the real diseases were, and this is now where we're going. So that's one initiative. We also have other initiatives within the communities. There's one community in particular in the southern part of Kenya, around the coastal area, where these are very neglected, very remote places, where we notice these women in particular, they go, the water source is the same water source that the animals will feed from, the kids will wash, they use it as maybe the toilet as well. The women will go again, wash their clothes. And what happens in such a village or in a community, they have what we know as bilharzia. Those snails. And then those snails really have a very bad effect, where the disease they cause, that is the female genital schistosomiasis, where it affects the reproductive system and later on can lead to very serious complications. So we started an initiative with a group of us, both from the university, donors, and also the county government of Kilifi and those areas, to educate the women, to recognize also symptoms, because some women will come and tell us, if my child has not urinated blood in a long time, meaning there's something wrong with my child, because it's so normal for those children to urinate blood because of the bilharzia. But then it becomes so normal, they think if a child is not urinating blood,
they're not normal.
Okay. So now we have to even start involve the schools in safe water sanitation, hygiene, avoid such water, and this is what you need to do, or if you have to use this water, this is what you need to look out for to avoid these complications you're seeing in women and also in their children. So again, there's still a lot to do. That's just one community or one or two initiatives. There are many more ongoing in the country and also in East Africa. But I would like to hear also from Reverend.
From Ghana, yes.
What's happening?
Yes, in Ghana, there have been many collaborative efforts, by NGOs, partnering with the government to give, to do, boreholes where places people find it difficult to access clean water. And it's gone very far. I can share that story with the northern part of Ghana, where it's so difficult to get water, and even the water that the women go to fetch miles, the same pool of water, animals eat them, and all those kinds. And NGOs like World Vision, Save Water,
Save the Children,
Save the Children, doing a phenomenal work, giving civil, which is good. Sanitation, the government, I think the previous government, it made in some initiatives where at least once a month all Ghana communities will gather together to do a cleanup, clean the gutters and all those things. So there is an effort made, but it is little and it's not very sustainable, because then I don't know why it is so. But I think people are aware and they know that it's good to do, but the will to continue to do it and the reason to do it is the thing that is lacking.
Yes, absolutely. Thank you very much for that, Reverend. And just before we wrap up the show, I want you to both take just a minute each. And, one of the things we try to encourage at Africa Health Check, it's about what you can do at an individual level. So I want you to speak to anybody listening and wanting to take action to promote WASH practices in their community. What is that one initiative they can embark on? What is the first thing that they can do? Maybe let's start with Dr. Marianne.
Yes, so there's a lot we can do, but starting from your own personal space or where you are at, first of all, just educate yourself. Learn what actually when WASH means, water, sanitation, hygiene, and then look around you. How is the environment? How are you disposing your own household waste? And
no fly toilets.
Yes, no flying toilets. And are you disposing your waste in a safe way even for your neighbor? Because again, you look at the community around you. Do you have initiatives? Again, I'm really proud of Ghana. I know Rwanda also does that. I think every other time they all gather together and clean up the environment. I'd really want to see that even for Nairobi. But it starts with your personal space, as you then project over to the community, to the city, and to the nation around you. So again, and you can only do that if you know what you're doing and why you're doing that.
Exactly.
And again, I'd like to speak also to our governments and NGOs. Would like to see more boreholes if that's possible. Would like to see construction of a place that is clean where we can use as toilets, particularly in peri-urban areas where, again, some of these facilities we take for granted are not there. So we need to join hands together, Ubuntuism, within our countries, our cities, and make sure each and every person has a safe area where they can practice hygiene. There's good sanitation, because I always end this, a thriving nation is a wealthy nation.
Perfect. Reverend?
Yes, I will say this as a religious leader. Now, actually, in the Judeo-Christian religion, there is something about cleanliness, good sanitation, as part and parcel of the believer's makeup. And it is Bible-based. I wish I could quote the reference. But let me tell a story. God, even as a pastor, told the Israelites when they were leaving Egypt to Canaan, that they were in journey. And there is a scripture in Deuteronomy 23:12, 9 to 12. It says that when you have to go ease yourself in the open plains, use your weapon, to dig a hole And when you have eased yourself, cover it up. And then it says, the reason why you need to cover it up is because God is doing a patrol. He will visit. And when he sees that thing, that despicable thing, he will turn away from you. I understand that it is from that scripture where this term godliness and cleanliness is next to godliness came from that source. So I would encourage my fellow ministers in our church. Every year we teach on health, and one of the emphasis is cleanliness, is decency, is living, personal responsibility, and then community responsibility.
Absolutely.
And since faith-based leaders, religious leaders, carry such power and influence over their members, and most of our people, they are illiterate, they can't read. You say these things in English. And since they listen to the pastors, why can't the leaders enforce these things we are talking about from the pulpit?
Absolutely.
And it will bite.
And lead by example. I think when it comes to WASH practices, it's just one of those things that it starts at an individual level. You lead by example, you take accountability for your actions, and collectively, really, that's what our actions are going to sort of make a difference. And I've also taken note as what you're saying, Dr. Marianne. It is time for those private sector partnerships to build boreholes to ensure people have access to clean water. That brings us to the end of our show. But before we wrap up the show today, let us head over to Ethiopia to highlight our African health champion for this episode, as we found out why she is called Mama Whistle.
Mama Whistle, aka Beza Imama Fishka, stands out as an Africa health champion for her unwavering commitment to promoting strict hand-washing practices in Ethiopia. Following a cholera outbreak in 2016, she enforced rigorous hygiene rules, making hand-washing mandatory for entry to her restaurant. This simple yet impactful step has played a pivotal role in reducing illness and curbing the spread. Her efforts align with a study emphasizing the importance of effective hand-washing practices, particularly among school children, in preventing infectious diseases. Her legacy showcases the influence of individual initiatives in creating lasting improvements in community health and well-being.
Very powerful and motivating story by Mama Whistle. Definitely will be following more of her work. And that brings us to the end of today's episode. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories we highlight here. Be sure to connect with us on our Facebook, Twitter, Instagram, LinkedIn, and YouTube account. The handle is @AfricaHealthCheck. Until we meet again, same time, same place, remember, the future is Africa, the future is today.